I'm delighted to really have this wonderful panel on blood and blood product supplies. Good afternoon, everyone. Welcome to the COVID-19 webinar series brought to you by Africa Health Business in partnership with partners that are deeply involved in this subject around the blood in Africa. It's really an honor to have a wonderful panel here with us today. We have champions in the blood supply industry. We've got Aaron, who is the director of Damusasa, who will be our first guest speaker, first panelist speaker. And then we have Santana Mudoni, who's from Life Bank. They are based out of Nigeria as the head office, and she leads the Kenya team. And we have Eric Wenda, who is from Terumo BCT, and you're all aware of this organization in Japan. Terumo means thermometer, by the way. Talking about screening and taking temperatures today, it's a real honor to have all the panelists here. And a surprise guest speaker is Dr. Elizabeth Wala, who is the member of the National Advisory Committee, which was just announced and gazetted by Honorable Mutahi Kagwe today. So Elizabeth, really, it's a pleasure to have you. We would like to really begin with you, giving your overview and giving your words on what this challenge is going to look like before we actually go on to our panelists in order, which is Aaron from Damusasa, then Santana, then Eric Mwenda. So thank you everyone for tuning in. Dr. Wala, yeah, you're really welcome on this panel. Please proceed.
Thank you very much, Dr. Amit and my fellow panelists. Good afternoon, everyone. So it's a pleasure to find that we've been appointed to an advisory committee that's supposed to advise and oversee the supply and utilization of blood and blood products. This was gazetted today. We have our chairman, who's Mr. Abbas Gule, formerly of Kenya Red Cross, and we also have other specialists. Now, one of the background to this is that we've had quite some challenges in streamlining and the utilization of blood and blood products in the country. And as partners and consumers of the blood and blood products, we got together and consulted with the Ministry of Health to find ways in which we can streamline these services. So when devolution happened, the Kenya National Blood Transfusion Services at this time is currently a department under the Ministry of Health, which in a way limits the type of control or the type of services it can offer. We have county governments, and with the devolution of health, many of these are running their health services to a degree, and there's a bit of disconnect between the Kenya National Blood Transfusion Services and the consumers on the ground. We have also noted that we don't have a culture of donating blood, so we want to see in place a future where Kenyans are proud to walk into a facility every 4 months for men, or every 3 months every 4 months for women, or every 3 months for men, and donate blood from a healthy voluntary donor, because that is what WHO has laid out. We also want to ensure that we are implementing WHO guidelines that were released this year on safe blood and blood products, and this encourages streamlining of services, whether it's during emergencies or routine services. Now, our mandate is quite broad, but generally, in a nutshell, we are supposed to look at areas that are affecting the practice of transfusion medicine in hospitals and health facilities. We are supposed to design communication and social mobilization or marketing for donor mobilization. We need to find a way in which we can facilitate the knowledge, management, and availability of information and data on blood and blood products. In this era of digital health, this is a very important factor to this. And there are many other areas that we are supposed to look at, but generally develop a system to resolve the perennial shortage of blood and blood products. We've seen during this COVID-19 period that the situation that was there has become even worse because people are limited in terms of movement or social distancing. And thus we have to be creative and find a way of ensuring that we still have blood and blood products in our hospitals. So thank you very much. I look forward to the work that's cut out for us. I'm sure many do, because we keep on losing quite a number of people to deaths that are from bleeding, especially our women who are delivering. So thank you very much, Dr. Amit.
Thank you so much, Elizabeth. I think it's an interesting time, and I want to move to Aaron because much has been talked about testing, sometimes hydroxychloroquine. We're talking about treatment, but there's one big area that I hope the three panelists will talk about, which is plasmapheresis and what we're going to do about it. I know Eric will talk more about it. But Aaron, over to you. Something about what Damu Sasa does. We have people also from outside Kenya. And how are you going to help us with this situation in COVID? Please welcome Aaron Ogunde.
Once again, my name is Aaron Ogunde. I work at Damu Sasa, and I'm really grateful for this opportunity. And I want to also convey my thanks to my fellow panelists and as well as the attendees of this webinar. So Damu Sasa basically is where our blood services information management system, and basically we're built to support effective blood services management. We have the capacity to digitally support blood sourcing, blood donation management, blood screening, blood inventory management, transfusion management, and even hemovigilance, which is the surveillance of the entire blood services value chain. So we can do this at hospital scale, at county scale, and as well as national scale. Please move to the next slide. So owing to the COVID-19, the truth is that there has been reduced blood donations. And this is in part due to, one, restrictions in movement, social distancing, and COVID-19 contamination fear. Worse still is that we already had a deficit even before COVID-19 came. So we're only meeting about 30% of our annual 500,000 units targets, especially in Kenya. And this COVID-19 just came and made the situation worse. Next slide, please. So what I think are the possible solutions to, ensuring that we have a continuous and healthy blood supply during the COVID-19. One is that we need to amplify the need and also create awareness that we still need blood. So you see, the need for blood did not just simply go away with COVID-19. So we still have mothers who are delivering, we still have oncology patients, all of which need blood still. So the message that we need to really amplify is that it is still possible to donate blood and still do it safely in any facility of your choosing. The other solution that I think would work is that we need to ensure effective storage and the use of what we already have. So already we're in a shortage. The one thing that we don't want to do is to go ahead and lose what we've already collected, either through expiry or cold chain violation. So our work right now should be to prevent such things from happening so that we maintain what we already have, even as we go out to look for more. The other solution I think would work is that we need to enhance the collaboration amongst facilities. So we need to make it easier, faster for facilities, one, to share information on blood that is available so that one facility can share with the other. The other thing also is that we need to enable knowledge sharing, whereby one facility can exchange information with the other facility or all the facilities with regard to maybe safety procedures, with regard to how to handle patients, how to handle blood donors in this era of COVID-19. Next slide, please. The other thing we need to do also is that our technologies or the technologies we're currently using need to adapt to the current COVID-19 period. So the concept of blood donation drives needs just a little bit of tweaking, uh, which means that right now, with respect to social distancing, we need, the last thing we want to do is call for blood donation drive, and then we arrive 100 of us, in one small donor room. So the need for donor scheduling is now imperative. Uh, what we've done as Damusasa as well is that we've built a platform that allows for donor scheduling. So 3 easy steps where you enter your details, you select the time you'd want, and you select the facility you want to donate in, and you confirm the details. So the facility itself will have in prior specified its capacity on how many donors it can handle, with respect to social distancing. The other thing we need to consider is autologous transfusion, using devices such as hemofuse, where you can actually salvage blood from patients during surgery, so that you can either use this blood on the same patient, or you can take it through screening again and use it on different patients. Then we also need to focus on apheresis donations. So one good thing about apheresis donations is the fact that you can have a very large number of people donating apheresis products over a very short period of time, usually I think 2 weeks. So you can have a group every single 2 weeks donating blood. So I think this can really boost the numbers in terms of blood availability. The other thing also we can do is that we need to enhance quality assurance. So it's not enough to just conduct affairs in a quality manner. It's also good for the public to see that quality is being done. A good example is the fact that my barbershop has sent videos to clients where they say, they show you how well they're taking precautions to ensure that you can get a haircut in a safe environment, with regards to COVID-19, how they're wearing gloves, how they're using sanitizers, all that. So I think also facilities need to show the public measures that they have taken to make sure that you can go and donate blood in a safe environment, because the last thing you want is to go to save a life, then end up being the one who needs saving. Then we also need to do proper demand mapping of where the need for blood is, how do we allocate resources to those needs, and just collective national monitoring. So if we see there's a certain region that requires this amount of blood, we can actually be able to channel resources to that region. So how do we conduct a scheduled blood donor drive? How do we say one facility has enough blood they can share with that facility in that region? So we need to do this in order to ensure that no one region or no one facility is left suffering, because ideally it is the patients who are suffering. Next slide, please.
Aaron, you might want to say what apheresis is for the people who want to know what that means.
Okay, just go back to the previous slide, please. So apheresis donation is the type of donation where instead of donating whole blood, as is with a normal donation, you can actually donate just a component of that blood. So you can actually just donate packed red cells, and the rest of the components are pumped back into your bloodstream. So this process is much in terms of how often one can donate, you can actually donate after every 2 weeks. So it's just a process to ensure, one, you're fit for donation after
So in
2 weeks.
essence, it's part of your blood. It's not your full blood. It's components of your blood.
Yes, components.
Still
So
keep the other components in your own blood.
yes. So this
Thank you.
actually enables
Okay.
you to be able to donate every 2 weeks. Okay. Next slide, please. So part of our contribution, and since we've been working on Damsesa for a very long time, we have platforms that support with donor relationship management, which part of our COVID-19 contributions that we're offering this platform for free. So hospitals only need to plug in. We also have the inter-facility platform that allows facilities to share information on available blood and also exchange information. This we're also offering for free. And we have hemovigilance platform where you can actually surveil the entire blood services value chain. We have an information exchange platform. We have an intra-facility management platform where you can manage your inventory, prevent such things as expiries. You can conduct quality management procedures. You can do unit testing. And we also have a referral management platform where you can refer patients to secondary care, and even donors who are in need of secondary care. You can use the same platform for that. So I think with that, those are just a few suggestions I have about what needs to be done in terms of securing a healthy blood supply during the COVID-19 period.
Thank you, Aaron. That was really, really good. And we know more about Damusasa now. In the interest of time, let me welcome our panelist, Eric Mwenda, who's the country manager of Middle Africa. Eric, we want to hear about Terumo BCT and everything to do with plasmapheresis and what your company does. Over to you, Eric. Welcome. You can introduce yourself and proceed.
Thank you, Amit. So I'm Eric Mwenda, as you can see over there. I'm the country manager at Terumo BCT, Middle Africa. So these are the 26 countries on the east and west of Africa, minus the Maghreb and minus South Africa. So Terumo BCT is a medical device company, and we pride ourselves in that we make products and provide services to collect, process, and treat blood and cells to help patients in need around the world.
Hello, can you hear me better now?
Santana, we will come back to you after Terumo's presentation, but I can tell you your sound is still not correct.
I've already done that.
It's not working, Santana.
Hello, can you hear me now?
No, not clear. Why don't our team get back to you on this? Can Pooja and Liz call Santana on a call and see if you can get a separate device on which she can log in? Would that work? Sorry about this, Eric.
No worries, Amit. Yeah.
Please proceed.
All right, yeah. So as I was saying in my introduction, everything we do begins and ends with the patient. So as our discussion is titled today, we are discussing how to secure blood supply during COVID-19. And my first slide there has a number of first ladies from across the continent. And this photo was taken last year during the UN General Assembly in New York, where we had the launch of the Organization of First Ladies in Development, who are quite passionate about blood. If you realize, WHO has classified blood as an essential medicine. And in this period of COVID-19, if we are to secure our blood supplies, we also need the help of opinion leaders who can also give their voice towards ensuring that we have safe and adequate blood. So when blood products are not available or safe, you'll realize that lives can be lost. So imagine the positive impact if we could increase access to blood and cell therapies. And at Terumo BCT, we focus on it every day. Next slide. So our parent company, as Amit ably said earlier, is the Terumo Corporation, a nearly 100-year-old innovator in the healthcare industry. And the start of our name Terumo is from a thermometer, as he shared earlier. And so very apt name at this time of history when we are battling COVID-19. So as part of the Terumo family, everything we do supports our global mission of contributing to society through healthcare. And our solutions are used in a variety of markets across the whole blood continuum. And our foundation is in blood management. We support transfusion medicine with solutions that transform a blood donation into a safe, transfusible blood component. So we play across the blood center segment. And in the blood center segment, we have our apheresis devices, as Aaron mentioned earlier, where we collect, we process, we reduce pathogen within the blood components to support transfusion therapies. We have our hospitals and healthcare division, where we have our therapeutic devices. So that's therapeutic apheresis, cell collection, and autologous autologous biologics to treat health conditions. We go further, lots of discussions are now happening around vaccine development, mesenchymal stem cell use and such discussions. And we have a cell and gene therapy division. So we give researchers manufacturing technologies and integrated strategies to advance cell and gene therapy treatments. And then of course we have our pharmaceutical solutions, which are within the wider Terumo group. Next slide. Just to bring it home, since we are discussing securing blood supplies within sub-Saharan Africa, also expanding geographic impact can mean building a footprint in multiple regions. And of course, the Nairobi office was opened as a training center to enable us to train personnel to upgrade a lot of our blood centers. And an example of this strategy is the work we've done in Ghana, working with researchers, hospitals, government, and the Japan International Cooperation Agency. So we partnered to implement programs to better protect blood transfusion recipients in Ghana. This collaboration continues to influence the work we do and to build bridges into other opportunities, including all sorts of interventions in this period of COVID-19. Next slide, please. So as I mentioned, we are part of One Terumo, and we like to unlock the potential of blood and cells in a variety of ways. So just to give an introduction, the device, hello? Can you hear me, Yamik?
Yes, I can hear you.
Yeah, so I was saying that our apheresis device is the trimmer axle, which you can see there on the slide. And we also have our pathogen reduction technology, as I mentioned, the work done in Ghana, reduction of malaria in whole blood, up to 90% reduction. We also have our therapeutic device, which is the spectroptia system. We've had a lot of questions around convalescent plasma and plasma apheresis, the collection of convalescent plasma and its use in patients. And I'm proud to say that our device, the trimmer axle, is one device that's used in collection of antibody-rich plasma. We've also had emergency use approval for the spectroptia using a column from Marker Diagnostics for cytokine removal. So as you realize, during for most COVID patients, cytokine storm is actually a life-threatening condition. And so we've had the FDA have the confidence to give us an emergency use approval of the spectroptia device for to treat respiratory failure in adult patients with confirmed COVID-19. The treatment reduces the pro-inflammatory cytokine levels. So, and as part of our work in securing blood supplies during this season, our medical division is very open to questions and guidance also to a lot of our partners across the continent. Should you want to deploy a convalescent plasma program in your blood center or hospital, feel free to reach out to us. Next slide.
Just one point.
Yes.
Eric, is convalescent plasma means patients who are recovering from the COVID. That is the plasma that is meant, that is what you mean by convalescent plasma, for just the listeners to understand.
Yeah, so that is the plasma that you collect from a patient who's recovered. We have blood centers that are partners in different parts of the world, and what most of them have been doing is to take a 28-day period before they collect that convalescent plasma. And if you may have seen on the internet, I think one of the famous people who donated their convalescent plasma was the mayor of Miami. So in use in different parts of the world, still an experimental therapy, but our medical division can walk you through and answer your questions on the different protocols that are available. With our trimmer axle device, you're able to collect plasma and then process it for use. Yeah. Have I answered your question, Amit?
Yes, yes.
Good.
Thank you, Eric.
Yeah. Yeah, so my next slide, maybe what I would like to add is that despite COVID-19, life continues. And I think I mentioned in my earlier slide on our abilities with our therapeutic apheresis device. And this is one of our patients in Uganda who's a sickle cell disease patient and has been treated on our Optia device. So the red blood cell exchange, very critical for sickle cell disease patients. And so, as I said earlier, we unlock the potential. We believe in the potential of blood and cells to do even more for patients than they do today. So as I said earlier, everything we do starts and we'll end with our patients. Next slide. So we continue to contribute to society through healthcare. So we'll continue innovating and investing. It's a question that we've been asked a lot. You know, many companies are scaling back. They're removing certain technologies because of the impact on economies across the world. But one thing we'd like to reassure our stakeholders is that we continue to invest and we continue to collaborate across the healthcare ecosystem to ensure that we are able to serve more patients during this period. Next slide. Let me thank you, and I'll hand back to Amit, and we'll take it from there. Thank you.
Thank you. That was really, really insightful. I'm sure we'll have many questions about it when we come later. But let's move to Santana for the presentation before we go into the Q&A discussion.
This is Kemi from LifeBank.
I can hear
Awesome.
you clearly.
Yeah.
Apologies for my colleague. I think she's had some issues this morning. And I figured I would just help her. She's prepared a lot, so I really wish she could have done the presentation, but I will go ahead and take it.
And Temi, introduce yourself. It's lovely to have you calling in from Nigeria. Introduce yourself and proceed.
Right. My name is Temi Giwatubosu. I'm the founder and CEO of LifeBank, which is a medical distribution company stationed. Our first country of operation was Nigeria, and I'm calling from our Nigerian office. And my colleague in Kenya was, Santana, who was meant to give this presentation, but unfortunately, because of technical issues, she couldn't. But LifeBank, like I mentioned.
Hi, Tammy.
Hello?
Hello?
Okay, so we have both of you now. Temi, you want to give Santana a chance? So through Liz's phone, Santana, carry on. We'd like to hear your voice. Let's see. Tell us about these lingering questions.
Okay. I apologize for the Wi-Fi issues I've been having today. The slide I'm sure that you're showing on your screen, I painted a scenario of a nurse in a hospital who is tending to a patient who doesn't have that long because they need an emergency blood transfusion. So some of the lingering questions at that point in time include you as a nurse not being able to know where you can get equipment and where you can get this blood transfusion. There's also issues on safety. You're not really sure that this blood is safe. So we've had so many cases of patients receiving blood that is contaminated or blood that has already expired, and it's not an easy thing. We've had so many of these cases happen before. And there's also the concern of whether the patient is going to be able to afford the cost of that transfusion. So, and this is where we come in. Next slide, please. This is where we come in. As LifeBank, we've partnered with 60 blood banks that regularly update their inventory to ensure that no supplies get waste. So at a time like this, we've been working very closely with them to ensure that we mitigate any potential shortages that would happen before they even do. On the other hand, hospitals are able to place their orders within a few minutes. As you can see, there's a USSD code, and they're also able to query a database to place these orders. And then when the order is placed, we're able to deploy our medical dispatch riders, who then have a dispatch app that is linked to Google Maps for easy navigation.
Hello,
and
sorry.
with this, we ensure that,
Hello, sorry.
medical dispatch riders don't have to, yeah?
Sorry, we
We
can't
ensure that
hear you, Santana.
You can't hear me?
There's so much
Hello?
echo. There's so much
Okay.
echo. I think Temi should take over. There's so much
Okay.
echo. Yeah,
I
it's
think
very
that's
frustrating.
I think it's a fair idea. Thank you, Santana, for that effort, and thank you, Liz. Temi, can you come back online and finish the presentation so we can move to the Q&A?
Sure. Thank you, Santana. You tried a lot, and I would just basically complete what you've started. So we're a medical distribution company. The idea is to, under COVID-19, you know, one of the things we say is that COVID-19 does not stop people from having babies. It doesn't stop them from needing blood transfusion. It's also like Eric mentioned earlier, it's also, you know, a potentially important, blood transfusion is potentially important in actually treating COVID-19, particularly because I read recently about some blood clotting cases. So making sure that blood is actually available and ready, not just available within the country, but actually within the facility where the patient is being treated is pretty critical. And that's where we come in. So like I mentioned, we're a 24-hour medical distribution company helping busy hospital teams find the blood that they need. And I was very excited to hear from Damusasa, which is a very interesting and much needed innovation and platform. And for us, I think we are, you know, very complementary with everybody who's spoken in terms of where we fit in. We're sort of like that last mile, that moment when there is a shortage in the hospital already, when, or perhaps there's not even a shortage, when there's a scheduled surgery or scheduled procedure, we're that partner to get that product in the right condition and right to the hospital using multiple different tools. We are also present in Ethiopia, and in Ethiopia we use, you know, we use tools like drones to deliver. In Nigeria, we use boats, trucks, and motorbikes to deliver these critical supplies. And we've done quite a lot in terms of getting blood or even oxygen to the hospital at the time it's needed. So, like I mentioned, one of the most important things we can do as a blood community is to ensure that we are simply running and we're doing our work. One, we're ensuring that there's enough blood donors that can give blood. We're ensuring that we're you know, driving innovation, particularly in you know, creating blood products, either through apheresis or through centrifugation system. We're making sure that we're being more precise in the blood and blood products we have available to the patient. And for us at Life Bank, the work we want to do is make sure that blood is available anytime it's needed in any hospital across Kenya. And for us, we say we're going to move things, we're going to move all products to every village, every town with any tool that we need to use. So that's Life Bank in a nutshell. We've done a lot of work, particularly in Nigeria, around COVID-19 response. Apart from just running our normal operation, we've also tried to help Nigeria and also Kenya find critical products like ventilators, respirators, and even ICU beds. And we are building a national register for Kenya for these products that are available in private hospitals so that it can help serve public hospitals who are treating COVID-19 patients. We're also doing a lot of work around expanding access to oxygen. Medical oxygen is such an important component of COVID-19 response. But the most important thing that we feel we are doing is just continue operating and continue delivering these critical medical supplies, blood products, round the clock to hospitals who need it. We've done a lot. We've served over 7,500 patients in Lagos, in all over Nigeria where we operate. We have over 450 hospitals, and we've moved over 21,000 medical products, mostly blood, to hospitals who need them. So for us, we just want to bring this innovation to Kenya. We want to help Kenya improve the blood system and really save lives and drive impact in the country. Thank you.
Thank you so much. That was really wonderful to show what we are doing at the last mile. And I'm sure for Santana and Timmy, the questions are coming in. We would like, Christine, if you can allow me to share my screen. Let's move into the questions that have come through. And I'm just projecting my screen for all of you to have a look. Dr. Wala, this is one for you. And then there are a few for Aaron, and then we'll come to Mwenda, and then Temi and Santana. Are you collaborating across Africa? Ask Peter Mills. For example, collaborating with South Africa Blood Services. What's the interlink, intra-Africa blood situation, Wala?
Yes, so thank you so much for the question. This should be part of the experience sharing and learning across different countries. So since we've not yet started the meetings, I believe it will be part of our work cut out. Thanks.
Okay. Aaron, we'll move to you. You've seen the question there. The first one is, do hospitals collect transfusion reactions and populate hemovigilance platform? From Aich Ba. Aaron, are you online?
Oh yes, yeah, I'm here. I was muted for a bit, sorry.
Go ahead.
So to the first question, do hospitals collect all transfusion reactions and populate the hemovigilance platform? We're having a challenge with this because right now, not all hospitals are able to collect and populate transfusion reactions. So some do, and for those, even for those that do, sometimes the reports come in late, a month later, which is not really helpful in terms of trying to investigate and trying to make sure that it doesn't happen again. So one of the things that we've done at Damusasa is to put in place a digital platform that allows for immediate and real-time reporting of all transfusion reactions, and not just transfusion reactions, but even blood donation reactions. We also have within the platform an investigative part where you can actually now proceed to conduct investigations on what the transfusion reaction was all about. So whether it was adverse or whether it was an acute. Then the second question is on
from sickle cell carriers.
Sickle cell carriers. So the question is it true that blood from sickle cell trait is not useful? Well, the truth is I wouldn't really have a correct answer to that because my knowledge is a bit limited on that because I'm mostly on the ICT side. So I think I can leave that to one of the doctors who's among the panelists, mostly maybe Dr. Wala. In which counties is Damusasa operational and what achievements can we cite? Because for Kenya, blood is a rare product, just as. Okay, so one of the counties we're operational in is Nairobi. So we're at the Kenyatta National Hospital. We're at, we just started work with Gertrude's Children's Hospital. We are at Jacaranda Maternal Health Hospital. Outside Nairobi, we're in Kisii. There's a hospital known as Oasis Specialist Hospital. In terms of achievements, we have reached out to over 50,000 registered donors, some of whom really came in handy during the Dusit D2 attack, where they were mobilized and they came in large numbers, over 1,500, to donate blood at the Kenyatta National Hospital. Ours is a work in progress in terms of reaching out to all the 47 counties in Kenya, and hopefully soon after outside Kenya. Where is the current strain experienced? Is it with particular blood components or with blood as a whole? In that case, as apheresis donations the way to go. So I think as Mwenda from Cherumo said, one of the key things is that they try to unlock the potential in blood and blood products. So the problem in general is the pain in the entire blood services ecosystem is the availability of donors who are willing to donate. So I've read research that currently in Kenya, of the adult population, less than 10% actually donate blood. So when we get to a scenario where we have bigger numbers of donors who are willing to donate, and I think it will just be a question of what type of donation is needed. But we're not there yet. The key problem we have right now is how do we get the donors first and foremost? Then how was COVID-19 affected the proportion of blood donors in Nairobi roughly? COVID-19 has affected the proportion of blood donors, and not just in Nairobi, it's countrywide, and not just countrywide also, it's, I think all over the globe. Been reading, they have the same issues also in the US, in other parts of Africa. And like I said in my presentation, one of the reasons is, the restriction in movement. So if you're on lockdown, for example, it would be hard to go and donate blood. So the other thing also is the need for social distancing, which has really put a bump on the whole effort of blood donor drives. So since then, it's really challenging right now to organize a blood donor drive. The other thing also is that we have this fear of COVID-19 contamination. So, and hospitals are the worst affected. So the people seem to have this notion that if you go to the hospital, you might get infected. And I've been actually talking to some friends in hospitals, and the numbers of people going to hospital right now are really reducing. And you find that even people are actually treating some things at home and actually or going to their local chemists. So people don't want to really go to hospitals to get treatment. I think the same has also applied to people wanting to go to, not wanting to go to hospitals to donate blood. I think I've covered all the
Wala,
questions.
what do you think? Sickle cell, when donors come to hospitals, when we have history of sickle cell, we actually don't advise them to donate. That's clear.
Yeah, it's so the donor, it depends if they are carrying the trait. So they run the risk. Most people with sickle cell trait, first of all, run the risk of when you take the blood from them, that you're putting them at a disadvantage. But also the red blood cells are not as elastic as red blood cells from someone who doesn't have sickle cell. So you also, it's not that you'll transfer the sickle cell to the other person, but it's just about the type of red blood cells that you're transferring to the person receiving the blood. So
Okay.
It's not advisable.
Okay. So Eric, let's move to you. Tell me, the patients who have recovered, how many have we seen as recovery in Kenya? I know we've got 14, 15, but we've got quite a few who've recovered. The first two were invited to State House, if you remember. And,
yes, I remember, Amit. Yeah.
Have you met them, and have you had a discussion with those being discharged from Kenyatta University and other hospitals? Are we doing anything with the recovered patients?
Not yet. There's been a number of people that have reached out to us and expressed interest. And as I mentioned earlier, if you do have interest, even amongst our participants, please reach out to me. I'll give my email address, and I can help you to fill what is called a medical information request form. But at the same time, our government affairs head, Nigel, who I'm sure you know very well, has contacts across different regulatory bodies, because as you realize, convalescent plasma is still very much an experimental type of therapy, but being used across different parts of the world. And so different centers have different protocols. And so it's good to also have these peer-to-peer linkages, which as Terumo BCT, we are able to facilitate. But I'd also love to go back briefly to something Aaron mentioned on the ability of the donors to come to the blood centers, and something he mentioned much earlier on using their technology for scheduling. I kind of love that idea because currently we are also facilitating a number of our blood center partners across the continent to enable donors to come to the centers and to increase donations also. And so that's part of one of our initiatives also to enable adequate and safe blood at this time. You mentioned, Amit, earlier that we have a number of recoveries, so I would put the number now at about 60. If I'm correct, it may be plus or minus a bit. And those donors coming from best practice that we are seeing in other regions of the world may be eligible to donate in about the next 20 to 28 days. And so, should convalescent plasma programs be put in place in the countries, I would urge them to come forward and donate.
Okay. Yeah. There is another question about the cost from Charles Oliech.
On hemafuse. I think that's my colleague from Damusasa. Very good piece of technology that I've seen being deployed, I think, in Kitui.
Yeah. So, yeah, what is the cost of hemafuse, by the way, Aaron?
Hello. The cost of hemafuse, I think, is a question that would well be answered by Dr. Wala. So I'd like to throw it to her.
So, Wala, does it depend on where we do hemafuse?
Yes, so hemafuse is a medical device that allows the surgeon to sort of scoop up any blood that could be reused or given back to the patient from the abdomen usually, or from any bleeding organ. We have a pack of 25 that is currently retailing at around 20,000 per unit, per single unit. We are negotiating with NHIF to reimburse the cost, and for some facilities they have actually reimbursed the cost, because it saves for every patient that where you use hemafuse, you're saving 1 extra unit or 3 units sometimes for those who have bled a lot, to someone else who doesn't have that luxury of using their own blood during surgery. Thank you.
Let's move to Temi. You can hear us. Sarah is asking, are we going to see the worst of its kind in the next month, 2 or 3? And what are we doing about it? How is LifeBank? What does LifeBank feel about this?
Right. I think that, yeah, we've already seen a bit of shortages, even temporary one, particularly in Nigeria. And we think that this same concern is going to be widely shared across Africa, across the world, really. And I think one of the things we must do, and one of the things we are trying to do, even within our Kenya business, is to ensure that we're protecting frontline workers, which includes, people who are working in the blood system. And what we must do, as far as we are concerned, is to make sure that both the workers feel protected and the people who are coming, who are agreeing to come to give blood, being protected significantly. And thankfully, I think Africa has been spared the worst of COVID-19, which means that, our public health system, our own history of dealing with major pandemics has basically prepared us to respond to this virus in a way that has protected our citizens. And we don't want to create a separate, pandemic, if you will, epidemic, by not figuring out the blood donor part. And we don't want to have, significant maternal deaths and significant deaths of the most vulnerable members of our society because we basically ignored blood donation so far. I think there are, of course, alternatives like hemafuse is an interesting alternative as well. But I think for the most part, you're still going to need blood. And I think we need to make sure that we're protecting frontline health workers who are working in these facilities, and we need to show, just like my colleague from Damusasa mentioned, we need to show that we're protecting people who we're asking to come. People need to feel like they're being protected when they come, when they make this personal sacrifice to give blood, and people who are working there also need to be protected. So I think this is the solution to the problem we're going to have in the next couple of weeks if this lockdown continues.
Sure. And any country is going to be worse off from your own experience? Maybe there's no answer, but a Kenyan is wondering, any countries in Africa that you think need to be put on a hot spot for blood? Or are we all in the same bucket?
You know, I think there are some countries who've done better than the rest of us. I know that Rwanda has done quite a lot in terms of not just innovation, in terms of the ones we know about, which is sort of like the drone delivery. But I think that they've done a lot of work in just making sure that, you know, their blood system is state of the art and world class. I think that Nigeria has a lot of private sector participation in the blood system, which is also very useful. And South Africa is also perhaps ahead of the pack. I think that the rest of the countries in Africa have to invest more in the blood system, invest more in terms of all the components of the blood system, from the collection, donor management to stock management, like, you know, Damusasa is doing, and to distribution. You know, a lot of the issues that I always see, you know, within countries, particularly countries without infrastructure, without state-of-the-art infrastructure, is that distribution, the last bit, the distribution part now falls apart, which is where, of course, LifeBank comes in. We come in and we help structure the distribution in a way that is excellent. So for me, I think that's I think every country has you know, some changes to make, but I think that the rest of there's some people who need to make less changes than the rest, but I think this is a wide problem across Africa, and I think this is a problem that we all in this community need to solve together.
Yeah, well, thank you so much. I know people have asked about PPEs and how they should treat donors and the ones who are donating. I think it's very clear. Not much information is known, but I would suggest all the PPEs that we have for the phlebotomists and all health workers should apply, whether you work in the lab or whether you work in an isolation facility or ICU. There's a lot of information still evolving. Let's hear some last parting shots from you, Temi, first, and then Eric, then Aaron, and then we'll close up with Wala giving her last shot. So Temi, any last words from you?
Last word would be all hands on deck. Blood is blood is needed. There's no substitute for it yet, and we all have to do the work to make sure that it's widely available. It's the difference between life and death for a lot of people, and both the private sector players, you know, major NGOs, international organizations, governments, all have to come together to solve this problem across Africa, and specifically to solve this problem within this community in Kenya. Thank you. And we at LifeBank are happy to contribute whatever we can to solve the problems within Kenya.
Thank you, Temi. Should I ask Eric for your final comments?
Yeah, thank you, Amit. I'll close with some key facts that I always love to share. And these come from WHO, that of the 112.5 million blood donations globally, half of these are collected in high-income countries and home to 19% of the world's population. In low-income countries, up to 65% of blood donations are given to children under 5 years. And the blood donation rate in high-income countries is 33.1 donations per 1,000 people. In our setting, the number 4.6 per 1,000 donations is always thrown around. I'd venture to say it's much lower. And so my call to action would be, let's get out, let's get our communities to donate. Use technologies like the Musasa to schedule that donation. And also, as different blood centers work across Africa, deploy technology that can help you to collect adequate and safe blood without having to spend too much, and also build massive centers. So, and in this light, I have apheresis in mind, as Aaron mentioned earlier. You're able to collect a double dose or a single dose with one patient, and still at the same time have a transfusible dose that can be used on your patients. I take the example of Rwanda, as Temi mentioned. They currently use 2 of our trimmers to service the whole country. They've deployed drones to deliver blood every day. They use our blood bags there, and with a lot of success and an ability to satisfy blood demand in the country. Thank you. So those are my closing submissions, Amit. And if anyone is interested in convalescent plasma, please reach out. I'll put you in touch with our medical division, and they can enable collaboration between different peers.
Thank you, Eric, so much for that. Let's move on to Aaron. Aaron.
Thank you.
Yes, your final statement.
My final statement, one, is to thank AHB for giving the opportunity for my panelists, fellow panelists and I to contribute on what we think could be done in securing blood supply during COVID-19. My parting shot would be to remind the donors who are here, who are also potential donors, the fact that you can still donate blood safely. COVID-19 does not mean you still cannot save lives. You still can, and you should go out to do so. Our platform is available. We are offering the donor scheduling platform free of charge. So please, if you know of facilities that are interested, please feel free to reach out. We're ready to help, and we're looking forward to African solutions to African challenges. Thank you.
Thank you so much. Let me move on to Dr. Wala. Your parting shots, please.
Yes, thank you for this session. It was lovely connecting again with all 3 partners. For us, we're looking forward to your views. We'll be collecting a lot of feedback from the consumers, from the specialists. We have on our panel quite a variety of skill sets, including someone who's an expert in communications and behavior change, because we believe that we are able to develop a culture of donating blood and also ensuring that this same blood is safe for use. Thank you very much.
Thank you so much. I would like to thank all the attendees who have joined us from different places. I would like to thank people like Bisi Bright from Nigeria. I want to thank people from Japan who've joined in, like Yuko. I've seen also Hiroki there. I've seen colleagues from Zambia. I've seen South Africans joining. What we'll do, we'll keep up with this webinar series, and the team which are at the back here helping us at AHB will keep you updated. Thank you, Collins, Nishit, Christine. I'd like to thank Kiran. I'd like to thank Liz, Malus, Patricia, and Pooja, who've been really on the forefront in making this series happen. I know blood and blood products are a big issue. We are probably not paying as much attention as we should. I hope that we don't have those many type of casualties that require this kind of service. But if we do, we should be prepared. Just like we're giving a lot of attention to oxygen, I think we should be also giving attention to blood, because it's the red blood cells that carry the oxygen. And with the latest studies that we see and read, there is some kind of a collaboration between the blood stability and the blood efficiency in the blood after COVID infection sets in. So we really don't know whether the transfusions could be one big answer to making sure that the ventilated patients have a better success rate of recovery. lots more to learn. Every day we are learning new things around this, but I would really like to thank all the panelists and all the speakers who've joined us for this session. Have a wonderful evening. Have a wonderful day, whichever part of the world you've joined in. Keep connected.
Thank you.
Thank you and bye.
Thank you, Amit. Yeah, bye.